Okay, we now know the best ways to prevent pain from working in the yard, but what if the damage is already done?
Which oftentimes, unfortunately, it is. So we have Cleveland Clinic Dr. Trishul Kapoor joining us with some helpful tips because a lot of people probably are watching right now and thinking, yep, I know, or they don't realize what they did or that it was from gardening or doing something like that, because I'm sure like simple things can tweak something and cause you problems that you don't even realize.
Absolutely. I mean, that's the biggest thing when patients come to my office. They always ask, well, why do I even experience pain? It's a great question. It's a survival instinct. Your body is giving you a message that you're probably doing something you shouldn't, or something's happening that's altering your ability to survive, so to say. So important to pay attention to it. I think we're trained in today's day and time just to kind of ignore it and just say, well, I'll just go get some medication, ice it, heat it, it's okay. Generally, most injuries do resolve, but the ones that are persistent, you really should get it taken a look at.
Now you're sitting on your butt all winter long, then you go to the garden store and you put all these bags in your car, and you put all your bags in the car, then you're bending over, then you're digging, and you didn't feel like you did anything wrong, but then 2 days later, I gotta go see the doctor.
What would you say would be helpful tips for someone who was going through, specifically with gardening, issues from gardening?
Well, again, it's important when you're doing it, you have a certain goal in mind. You want to go and plant or pave the way or whatever you have to do. You're so focused in getting that job done that sometimes even if you're experiencing discomfort, you're going to ignore it.
Keep going.
Mm-hmm. Exactly, and that's what people commonly do. So what I recommend is if you're having discomfort, and especially if you're having pain, take a break and understand your environment. Look at your posture. Think about what you're doing and see how that pain came about to be. Keep a record of that every time you're doing, and maybe an indication to change your posture, get some support and sit on something, or support your joints in some other way, shape, or form. And if it persists, time to go see someone and get it evaluated.
What does RICE stand for? Do you know what that? It says here RICE. Is that an acronym for something? Okay. We won't go faster. We won't.
Thought it was a food.
It says home remedies for pain. Somebody says, is rice a home remedy?
I know it stands for something.
Ice compression.
Rest, ice compression. Is that all?
Okay, sure.
I love this right now.
There it is.
Rest, ice compression, and what's the E?
I don't know.
We don't. I can. This is amazing. Elevate. Rest, ice compression, and elevate.
Yeah.
Now, what about your nutrition? How can that play a role?
Yeah, so, diet's important, one, for weight management to begin with. So being in an ideal weight is super important because the way your weight's distributed in your body has different effects on your joints. That's the first and most important thing. But once you have an actual disease process in place, such as degenerative arthritis or spine disease or any other kind of muscle injury or strain, it's important to have the right type of nutrition to heal. So protein, having good amount of calcium, other nutrients, and things that we don't normally pay attention to because most of the foods you eat are just calories and empty calories. So making sure you look at the nutrition label and understand what kind of nutrients are in there.
Get some right protein,
Exactly.
right? Yeah, psychotherapy, that sounds like something I'd be interested in.
Me too.
What is psychotherapy?
Yeah, and how does that play a role in all this?
Yeah, it's super important because pain, never tends to be just one thing. It comes from many different forms. It's not just your muscles, joints, and nerves. It also includes your overall ability to understand what you're experiencing, your psychiatric factors, what kind of traumatic events you had in the past, what stressors you have currently. So it's important to separate all those different components to make sure that you understand your pain and understand how to gauge it and how to treat it and how you're responding to it. So the whole idea of psychotherapy is to help you process all of those things so you can better mitigate, whatever treatments we're doing, whatever medication you're taking, and have the most optimal response.
Well, because I can't imagine, especially if it's a chronic pain, what toll that takes on you mentally. So having that help, but then you, again, as we just saw there, you can help them with the physical, the occupational therapy on top of the mental.
Absolutely, yeah. The biggest thing is your mindset will determine how well you respond to treatments. And sometimes when you're in pain, it's hard to focus on anything else.
We talk about so many complicated things here with the docs from the Cleveland Clinic, and pain, it sounds like such a simple thing, but when we start talking about it,
So
it's very
complex.
complex and complicated.
Absolutely, yeah. I mean, patients come to me and they say, oh, I have low back pain, can't you just give me an injection? But the truth of the matter is, there's a lot of things back there, you
Yeah.
know, including muscles, joints, ligaments, nerves, even the like the cauda equina, which is like the horse's tail of nerves that comes from the, you know, the spinal cord itself. What exactly is causing it? Just because you have back pain, it doesn't mean it's just one thing. You're paying attention to one thing right now that seems to be at the top of that layer, but there's a whole bunch of other things underneath it that are come to fruition when you start paying attention to it later on. So we have to take it in a step-by-step process.
And that's why we need the docs to help
Can't
us
treat
through that
yourself.
process. No, and I'm sure there's always new procedures happening that you can help. I mean, every day they come up with something different. So it's always helpful. And think about it. Go to the Cleveland Clinic, see Dr. Kapoor. He'll be able to help you out there with all of those
Don't carry
pain
your
needs.
wallet in your back pocket.
Yes, we just learned that. Don't carry the wallet in the back pocket, gentlemen. It's amazing what that little wallet can do.
Just let your wife carry it. There you go.
That's a much better idea. Here, I'll hold yours for now.
There you go.
Thank you so much for being
Thank
here
you
today.
for having me.